Dunn, Editor-in-Chief of Becker's Hospital Review, and I'm here with Danielle Reno, ICD-10 Director with Sutter Health. And we're going to be talking today a little bit about Sutter Health's initiatives to get up to ICD-10. And we know that ICD-10, of course, has many benefits, increased detail that hopefully will give us more information about clinical issues and hopefully one day be used to help improve outcomes. But right now, it can be quite a challenge for hospitals who are preparing to move from ICD-9 to ICD-10. So tell me a little bit about what Sutter Health has been doing so far to prepare for that change.
Well, Sutter's been on a long journey thus far. Starting in 2010, we did an impact assessment, and then we moved to implementing some of our computer-assisted coding strategies, educating our coders, and engaging our physician leadership to be educated across the system regarding more specificity in the code structure and how it impacts their care and providing care to our patients.
And so I know that training is a huge part of preparing for ICD-10. So tell me a little bit about, after you did that assessment, you know, when you started the training and kind of what that looks like in your organization.
So it's threefold, and there's clinicians within our organization, coders, and then our providers. And so when we talk about coders, I think that's the majority of people that are going to be trained. They go through an assessment. We contracted with Precise to provide us with some online materials, and our coders went through the assessment period, and then they started taking anatomy and physiology as a kind of a prerequisite for the ICD-10 coding structure. Followed with that, we sent all of our coders through a HEMA boot camp to get kind of a kickoff for the organization. And after that, we've had our coders go through the online ICD-10 training that we've put on our online learning management system through Precise, and really tried to help them do more detailed training than what was offered in our boot camp. For the providers' specialties, we've decided to take a multidisciplinary approach where we have physician-led education sessions, either in person, via WebEx through kind of a lunch and learn style, or online. So some of our physicians in all specialties will get online access to the Precise University trainings. And then all of our top specialty areas will get WebEx or physician-led training sessions.
And tell me a little bit about what you have to do from now until next year when this goes into effect. What are your key initiatives or goals?
It's a good question. So the majority of the ICD-10 transition is related to technical remediation of our applications. And right now we're in integration testing, which means that we're trying to understand whether our data can flow from one application to the next, and then all the way out through our clearinghouses and to our commercial payers and governmental payers. And so we're in a lot of testing activity right now. I think the other bigger component of the transition is continued education to our physicians around clinical documentation improvement, and how we get that more granularity and specificity that helps patient care.
And have you received much pushback from physicians for this additional training? And if so, or if not, you know, do they understand the benefits, and how have you helped communicate that with them?
I think the challenge with physicians and engaging physicians is that they are so busy with patient care. And when we do finally engage them, I think they're really excited about the opportunity that ICD-10 provides to them. At Sutter Health, we're really looking at it from a perspective of improving patient care, improving the care for those patients' families, and communication between providers. And ICD-10 brings that, and I think it's a good thing for the healthcare organizations.
Great, and I think that's a great point to make, because we hear so much about the challenges with getting ready for ICD-10, but it's also nice to remind ourselves and physicians and our revenue cycle staffs that this really is a good thing, and hopefully will get us to a better place.
Yeah. It's really about patient care and improving patient care, and I think if we really step back and look at it from that perspective, we all benefit.
And just one last question. You have been doing this now for a little over 3.5 years. Any, I guess, key lessons learned that maybe you could share with others who may not be as far along?
I think start early, have a dedicated team to ICD-10, make sure that your education, your clinical documentation improvement programs are working and they're working well and you're focused on the right things, using data to be able to accomplish those goals. Engage physician leadership early. I think that's really critical. We assigned physician champions across our organization and it's really helped. And then get your revenue cycle team on board and your IS leadership on board so that you can ensure that your applications are remediated on time.
Great. Well, thank you so much for your insight.
Thank you.